Good morning, and thank you for joining us for our poster session today. We are going to be sharing about our project, implementation of a telepharmacy simulation within a Rural Health and Agrimedicine course. My name is Kelly Cochran. I'm a clinical associate professor in the UMKC School of Pharmacy here at MU, and I am the course coordinator. With me today is Dr. Barbara Kasper, and she is Associate Chief of Clinical Pharmacy Services at the Harry S. Truman VA in Columbia, and she is the primary instructor for this component within the course. As we were incorporating telepharmacy education within this course, one of the things that we recognized was that telepharmacy services are a great opportunity to expand patients' access, particularly in rural areas, to care, pharmacist-delivered care. But one of the challenges that we identified is that within pharmacy guidance for the curriculum, such as the CAPE outcomes, those do not necessarily describe any instructional principles or provide any advice or requirements around delivery of telepharmacy services. Additionally, there is a lack of literature that describes other types of pharmacy education in delivering telehealth instruction to pharmacy students. And so we wanted to make sure that our students are prepared for contemporary practice in a rural pharmacy setting. And so we designed this telepharmacy simulation so that they will be able to care for their patients in a virtual way. This course was initiated in the spring of 2019. And at the time, it had an enrollment of 12 students. Since that time, it has tripled in size. This course is delivered across our 3 sites in Columbia, Springfield, and Kansas City. In this initial iteration of the course and this telepharmacy simulation activity, we first started out with a lecture from our partners at Missouri Telehealth Network, where the students learned about telehealth principles. Then Dr. Kasper shared with them about 30 minutes of actual practical application skills, and they had a time to practice those. The students also utilized an AgriSafe Health Risk Assessment, and this is a tool that was introduced during that initial session, and it helps guide the student through talking about agricultural hazards with an agricultural producer, and then also highlights opportunities for prevention strategies. And this tool was utilized throughout the semester. After the didactic instruction and the application time, the students then completed a 9-minute simulation with an agricultural producer. In that time, the standardized patient, which was our agricultural producer, was played by one of our P4 students. We used Zoom video communications, but at the time, this course was an in-person course. And so the students would leave their room, go to do their simulation in another room with technology that was provided by the school. The encounter was designed so that it appeared that the student pharmacist was in a clinic setting and that the ag producer was in their own home. The students utilized an abbreviated form of this AgriSafe Health Risk Assessment to guide them in gathering a medication history, which is a critical skill for student pharmacists that they do actually learn within that P1 year of the curriculum. And then it also had some prompting questions around occupational risk exposure, which is taught within this course. The students were assessed by a recorded video of their encounter using a rubric that is listed below. And then the students also completed a reflective writing, and we also will share with you some of the results and themes from that reflection. Within this rubric, though, you will see that there are some things that are related, some components that are related to specific skills, such as eye contact and volume, as well as other components where we need to make sure that they're conducting this in a safe way where they have emergency contact information and location. In addition, as they collected the medication history or evaluated side effects, that was another component where the students would address if there had been a change for that farmer.
We evaluated 2 main items in our results. The first was the mean score on the telepharmacy simulation. The rubric assessed a total of 15 points, weighted as Dr. Cochran had mentioned above. All 12 students that were enrolled in the course did participate in the telepharmacy simulation, and the mean score, regardless of site or level in the program, was 11.4 points out of 15. When we broke down the scores according to pharmacy program year, this is where we did start to identify some differences. Our first year pharmacy students were the most common program year enrolled in the course, and their scores were a little bit lower than their peers in their second and third years. The P1 students' average score was 10.6, whereas the students in the P2 and the P3 year averaged a score of 12 out of 15. We also evaluated any differences in the mean scores across campuses, and we did identify some differences here as well. For the students that were located in Kansas City, their mean score was 10.8 out of 15. Columbia was a little bit higher at 10.5, and the students in Springfield had the highest mean scores of 12.3. Main difference here we do not feel has to do with any specific component of the location. It mainly has to do with the fact that the majority of the P1 students were actually enrolled at the Kansas City location. We had purposefully developed the simulation to minimize any need for clinical decision making, because we did recognize that we were going to have students across 3 different years of the program and varying skill sets and experience with direct patient care and ability to make clinical decisions. However, these findings do indicate that we still needed to make some changes with the way that the simulation was carried out so that students across all levels of the program would still be able to be successful. In evaluating the themes on the reflective writing questions, there were several challenges that were identified, and these are indicated with the blue bar, and then benefits of the simulation are indicated by the green bar. The most common challenge that the students experienced was having to make eye contact through the camera lens, as opposed to making eye contact directly with the individual that's in front of them. And this is something that is common and we've seen in subsequent years, and something that we highly encourage the students to practice. Students also indicated that there was some lack of familiarity with the AgriSafe Health Risk Assessment form, and so this led to some challenges when they were put in the simulation and needing to be assessed in a real-time situation. Some students also indicated difficulty hearing the patient, and others indicated that they had challenges being able to complete the simulation within the 9-minute time frame. The most common benefit that students indicated on the reflective writing question had to do with being able to apply these real-life skills to direct patient care, and they felt that it was relevant to real-life practice. So in conclusion, what we identified was some differences in the mean scores between our P1 students and the students that were in the P2 and the P3 year. We also identified some of those challenges through the themes, that was regardless of program year. And because of that feedback, we had implemented a number of changes when the simulation was carried out in the spring of 2020. The main change that we made with the course was expanding the didactic component that would introduce these telepharmacy practical skills to the students. So students now have the opportunity to not only see videos of these types of encounters in real life across a variety of settings, but they also have the opportunity for more practice through the use of vignettes and also through role-playing activities where the students have more hands-on experience with the AgriSafe Health Risk Assessment form and can feel more confident going into the assessed simulation. Another challenge that our instructors identified that was outside of the student feedback had to do with some technological challenges across the different sites. We were utilizing university technology this first go around, and there was differences in the types of devices that were being used. And some of the students were less familiar with those devices and struggled a little bit. However, when we had the simulation go in the spring of 2020, the course had to be moved online, and students were completing the simulations at home using their own devices. This proved to work out much better because the students were already familiar with their devices, and that is a change that we do plan to continue as well. So we will continue to assess this activity as we go throughout future iterations of the course, and we thank you for listening to our presentation today. Welcome any feedback or questions that you may have.